So incredible progress has been made in achieving the Millennium Development Goals the United Nations set in 2000. However, there still remains major issues in developing countries, such as poverty and hunger, gender inequality, child and maternal mortality, disease, environmental sustainability, and setbacks due to crises, shocks, and vulnerabilities. Much work still needs to be done in these areas in order to accomplish the UN Sustainable Development Goals by 2030. In the following slides, Ariel and I will expand upon these issues using data visualizations and information taken from the UN MDG report of 2015 and associated studies. So the UN MDG to eradicate extreme poverty and hunger had 3 different targets. The first target was to have the proportion of people living on less than $1.25 per day. Although the number of people living in extreme poverty globally fell by 1 billion people, the world's extremely poor people are still distributed unevenly across 2 regions, South Asia and Sub-Saharan Africa. This can be seen in the data visualization on the left, with Sub-Saharan Africa showing the least progress. Additionally, women face a greater risk of living in poverty. As the data visualization on the right shows, in 41 countries, women are more likely to live in poor households than men. The second target was to gain full and productive employment for all people. However, the data visualization on the left shows there is a lack of employment opportunities in comparison to the growing labor force. Young women especially are disproportionately affected by this problem. Again, we see this issue of gender inequality in relation to poverty. Although the proportion of workers living in extreme poverty has largely decreased, nearly half the population of employed people are still working in vulnerable conditions, as shown in the data visualization on the right. The third target was to have the proportion of people suffering from hunger by 2015. As seen in the data visualization to the left, the proportion of undernourished people in developing regions has decreased by nearly half. However, differences in hunger prevalences continue to exist across regions. The data visualization on the right portrays that the pace of reduction in the Caribbean, Oceania, Southern Asia, and Sub-Saharan regions has been too slow to reach target. Overall, much progress has been made to decrease the proportion of people living in extreme poverty and hunger. However, in order to achieve the goal of complete eradication, the world faces many obstacles and challenges. Additionally, the UN had a goal of eliminating gender disparity in primary and secondary education by 2000 and all levels of education by 2015. 5 of the 9 developing regions have achieved gender parity in primary education, as seen in the graph on the left. However, there still remains many countries that have not reached this target. In different areas other than education, women's political representation has increased, but is nowhere near parity. And furthermore, women are less likely to participate in the labor force than men, especially in Northern Africa, Southern Asia, and Western Asia, and they globally earn 24% less than men. The fourth UN MDG targeted to reduce child mortality by 2/3 by 2015. Although substantial progress has been made in reducing child mortality, with the trends that currently exist, it will take another 10 years for this target to be reached. And so then more children can and need to be saved from preventable deaths. Furthermore, socioeconomic disparities cause different rates of child mortality, as seen in the data visualization on the left. Lastly, measles immunizations have saved millions of children's lives. However, as seen in the graph on the right, progress in implementing immunization has stalled since 2010, and thus between 2012 and 2013, the case of measles has actually increased. The UN MDG to improve maternal health included 2 different targets: to reduce by 3/4 by 2015 the maternal mortality ratio, and to achieve by 2015 universal access to reproductive health. The maternal mortality ratio has decreased by 45% worldwide. However, there are disparities in access to maternal health across different regions as seen in the graph on the left. Furthermore, only half of pregnant women receive the recommended amount of antenatal care. In order to assure a safe delivery, the UN recommends 4 appointments in order for the mother to receive a basic care package and to detect any warning signs early on. Unfortunately, there is a lack of basic data on births, deaths, and health. Globally, only 51% of countries have some data on maternal causes of death, which prevents effective policies from being created. Now we have Ariel to present the remaining issues.